Hello, the presentation on entity relationship diagrams was prepared as part of the HAP 709 course on healthcare databases, which was taught by Dr. Alemi. This course was taught at George Mason University in the Department of Health Administration and Policy. My name is Holly Sadural, and I am a student in the Masters of Health Informatics program. I will be presenting entity relationship diagrams and what they do. But before I begin on what exactly an entity relationship diagram is, we first need to understand what our database is. In today's world, we live in a time where information and data is everywhere. We have to be efficient organizing, understanding, and determining the usefulness of the data that we create and how we store the information. There are several parts of a database we must understand. The first part is the purpose. So the purpose of a database is needed because it's crucial to the design. For example, hospitals need a database that only includes patient information, but human resources and the maintenance of hospital as a whole. Now, when it comes to ER diagram or the entity relationship diagram, it is very helpful in the design aspect of a database. The ER diagram helps prepare the structure of the database. What the structure will be the design, what information we want to include and exclude, and how to structure the data for future use. Once the purpose and design has been figured out, the data needs to be analyzed. From the data, an organization, such as a hospital, will be able to examine the needs of the hospital to provide a more efficient care system. Now that we understand that an ER diagram is important in the design of the database, we need to also realize that it is a graph that depicts the relationship among people, objects, places, concepts, or even events within an information system. So an ER diagram has three different components: entity, attribute, and key attribute. The first component I will go into detail is an entity. So in a database, there are tables of interest that are included that need to be divided into a list of entities. An entity is something that is independent, separate, or self-contained existence, like a patient, the diagnosis of a patient, and the healthcare provider of a patient. The next component is attribute. Each entity, such as a patient, has a set of attributes that describe the various characteristics of the entity. Attributes can be text, numeric, binary, or date types. So in this example, the patient has different attributes such as patient ID, name, and address. This is pretty much describing the patient. And lastly, there's a key attribute. So in here, the key attribute is patient ID. It is unique for each row of the table in the database. So meaning that there's no two distinct records in a table that can have the same values of the primary key. Another example could be a G number at George Mason University that identifies one student in the Patriot Web system. Now that we have gone over what is in an ER diagram, now that you have what you need in the diagram helps us determine the different relationships between different entities. I will go over the three different entity relationships, such as one-to-one, one-to-many, and many-to-many. So in a one-to-one, where one entity only corresponds to only one other entity. So in this example, think about it as a husband and wife. A husband can only have one wife, and a wife can only have one husband. For example, when related to healthcare, a table about patient's death has a one-to-one relationship with the table of that specific person. Next, one-to-many or many-to-one relationships. This is where an instance of one entity can be repeatedly used by another. For example, think of a mother can have many children, but a child can only have one biological mother. And when relating it back to healthcare, a doctor can have many patients. And lastly, there are many-to-many relationships, where one instance of both entities can be repeatedly used by another. For example, a videographer that shoots videos for weddings can be hired by many customers, and many customers can hire as many videographers as they want. For example, in tables such as patient and clinician, there's a lot of many-to-many relationships, since a clinician may have many patients and a patient may have many clinicians. So now that we understand a little bit more about ERR diagrams, I want to go a little bit more into the Learning Module 9 assignment. So for this assignment, we had to create a many-to-many relationship between patient table and an address table. So as you can see, the lines that are connecting the two entities depicts a many-to-many relationship, where the patient can have different addresses, whether current or previous addresses on file, and an address can have many patients located at that address. However, databases cannot have many-to-many relationships stored, therefore it needs to be modified. The entity on the left has only information on the patient, and the entity on the right has information of all the addresses of a patient, but does not connect what address belongs to what patient. So another entity needs to be created to capture the extra data. So what I did was I added a patient address entity. As you can see with the brackets, from the patient to the patient address, it's a one-to-many, and then from the address to the patient address entity, it's a one-to-many. So what this is saying, it provides the relationship of having it many-to-many, where you can see that in the patient address, there's a key attribute of patient ID from the patient entity and a key attribute of address ID from the address entity. So now going on with the Learning Module 9 assignment, you have to enter 5 rows of data into each table. And as you can see from the ER diagram, this is what the table would look like, for example. So here I am showing that 2 individuals can live at the same address, and 1 individual can have 2 addresses. It could maybe be a current one or a previous one. And with that, I hope you understand a little bit more about ER diagrams. And these are my references that I used to create my presentation. And for my tables that I created using the ER diagrams, I use Lucidchart. Thank you.